Marijuana and pregnancy. We found this picture on Instagram under the user Das Fuchs. This is his wife, and obviously they are a proponent of the use of marijuana. Why did we find it useful to research perinatal marijuana use? Well, there's been a trend of recent legalization statewide, and we believe that eventually it will be a federal legalization law. And they're doing disease-specific legalization of cannabis use. So cannabis and marijuana are very commonly associated with treating nausea, and nausea is very common for pregnancy. Medical marijuana is used to treat many different diseases and health issues, and people think that it's okay to use marijuana because it's a natural source. They're not thinking about the consequences. So the last reason we decided to research perinatal marijuana use is because we were curious about what marijuana would do to pregnant women and their children, their baby. Our qualitative article, the purpose of our qualitative article was to understand information-seeking patterns and perceptions about perinatal marijuana use from pregnant women who use marijuana. So the sample was 26 women. They were gathered either by verbally saying that they used marijuana during their pregnancy, or they had a positive urine test. These 26 women came from 5 different clinics in the Pittsburgh area. The results were inconclusive about health issues during pregnancy with perinatal marijuana use, but we did see that the main issue was that sometimes marijuana use can cause fetal death. So the limitations of this article was that there was a lack of follow-ups. There was a very limited geographic area into the urban Pittsburgh area, and it was using the legalization of marijuana as a concept of its research. So we believe that this article could better use a bigger geographic area, more rural and suburban areas also, instead of just urban. So the purpose of our quantitative article was to estimate the proportion of cannabis dispensaries who recommend marijuana to pregnant women. And this article also characterized those recommendations. So the sample size was 400 dispensaries, and it was proportional by dispensary type, legal medical marijuana places, retail, and both. So these dispensaries were contacted by phone, and there was a script used for each call. So the average length of the call was 2.4 minutes. Our quantitative article had several limitations, most of which was the accessibility to dispensaries. Because this was phone calls and not in-person interviews, it was hard to contact the people, and sometimes they didn't get through the entire interview. So the sample size was also limited because there are more dispensaries in urban areas than rural areas. The interesting thing is that when the dispensaries were contacted and talked to or asked about marijuana use during pregnancy, 65% said that it is personal opinion of the mother whether or not she should use it, and 36% said that it's safe, again for reasons such as it's a natural resource. So both THC and CBD, which comes in oil form, were recommended for the treatment of nausea in pregnancy. Only 31.8% of the dispensaries recommended talking to a physician before going ahead and using marijuana. So with prompting, 49.7% of the dispensaries reconsidered and recommended contacting a physician. We selected our articles on different resources, so some of them were from CINAHL. I think the qualitative article was from CINAHL. And the findings about perinatal marijuana use were inconclusive. So there were very few measurable results. The topic is too broad. There were a lot of articles about breastfeeding and marijuana use or other health-related issues that occur in pregnancy. So the sample size, the feasibility of researching this type of a topic is kind of hard because as of right now, marijuana use is not legal everywhere, so it can be hard and tricky to contact people who do use it. The sample size is it's hard to get a big enough sample size because of these issues. It's hard to recruit because of the legality of the issue, and planning during pregnancy is a very hard thing to do. So if marijuana was to be legalized federally, I believe that this type of research would be more easy to do, but it would also become more relevant because with the legalization, the marijuana will become a lot more accessible, and so it will be much more necessary to understand the implications of its use. So we wanted to understand where women were finding the information about cannabis use. Our qualitative article discussed this. A lot of women are finding their information on the internet. They're also talking to friends and family who they've known to use marijuana during pregnancy, and very few of them are talking to their physicians or doctors. If they are to visit their doctor, it would be a very important topic once they verbally express that they use marijuana or want to use it, or they have a positive urine test. It would be important to discuss the possible consequences of its use. So one possible way to talk to women is to provide this type of information during their OBGYN visits. Relying on the internet is very tricky because not all of the information is true. And a dispensary is a business that's trying to make a profit. So again, their advice may not be completely true. Because of the legality of the issue, people are very unlikely to ask for advice on this topic, so healthcare providers should just openly provide the information. The ways that we chose to implement the data that we've learned is to be aware that the information women receive may not be exactly true. The places that women are seeking information don't have the need or the ability to give true scientific results about the possible consequences of perinatal marijuana use. So another way, because of the legality of the issue, would be just to talk to the women very openly about this issue without asking if they would like to know. Also, we should be available to teach information about perinatal marijuana use in high schools and colleges so that the knowledge base is more broad. Again, we have learned that women are receiving their information about perinatal marijuana use from the internet, friends and family who have used during pregnancy, and dispensaries. Very few women are talking to their physicians about it. There is not enough information, research-based information at this moment, to offer any true malignancies in perinatal marijuana use, but we do know that it causes fetal death in some circumstances. So research is a necessity at this point because the trend of legalization is spreading, and so marijuana is going to become more accessible and acceptable to use. So we need to understand the implications of its use in all areas, including pregnancy. And that is the end. Thank you.